Hello, everyone. It's Dr. Chris Mascetta with Richfield Chiropractic and Wellness Center. If any of you have ever seen me at a sporting event, whether it's a pro motocross national or a supercross or arena cross, or maybe at a cross country meet or track and field event, you've probably seen me running around and lugging this big bag. So I thought maybe it would be fun or kind of cool to kind of go through what I have in the bag. And the reason I'm always wearing it is because I have a lot of stuff in here, and it would be a lot to replace if this bag disappeared. So anyway, I thought it would be cool to kind of go through all the different tools that I carry in here and their usages and why I use them and why I have them at the event. I also want to talk about my role as a chiropractic sports physician at these events and what I do. And really it's three different things. One is performance, improve the overall performance for the athlete on the day of competition, which number two is going to reduce the risk of injury. And number three, obviously we want to work with any lingering injuries that might be going on with the athlete, either the day of competition, maybe something comes up or something that they've been dealing with. We want to manage those. Being that I brought up motocross, my plan in this year is to do probably 2 to 3 of the outdoor pro nationals, as well as maybe 1 or 2 supercross races. I haven't even looked at the arena cross schedule. So I'm not sure if I'll be doing any of those, but I certainly would like to start up the motocross practice again. I will most certainly also be working with Matt Hammer at his motocross schools that are in the area. So some cool stuff with the motocross. I'd like to just really get my hands back in there. It's been a couple of years. So that'll be fun. And then with the track and field, obviously I'm going to continue working with my girls at local events. And once they finish up their running careers, Taylor's running in college, Caitlin's in high school, planning on running in college. So we still have a few more years at least, of their track careers. But after that, do more of the USA track and field stuff and, continue with that practice, which is cool. But anyway, what I have in this bag is really fundamental to a successful day at a sporting event. So let's just jump right into it. Oh, this thing's pretty heavy. So let's see, what do I have in this top pocket here? So this is just basically some PPE stuff. I have some gloves, easy access. And then these types of things, I'm not even sure what they're called, but they wrap around your neck. So I use these sometimes when it's a cold out. Sometimes the supercross races or arena cross are in the winter and it can get pretty cold. So I like to have something like this to put around my neck. Or in the other effect, sometimes it gets really, really hot. So these kind of keep the sun off the back of your neck and things like that. Also, I can cover my face if it's a situation where I want to have a mask on. So those I use, and obviously some gloves, runner's gloves. These are great, again, if it gets cold. Then going into the front pocket, and this is really where I keep really the fundamentals. A lot of the stuff that I would use on a regular basis. Now, what I don't see in here is my activator. I wish I had that so I could show you, but I don't want to leave right now. The activator is an extremely important tool for me, especially working with athletes. Obviously, the chiropractic is the most important service that I provide. Everything else complements it really, really well. So the activator is a handheld adjusting tool. It's a spring activated tool. I use it a lot to gently adjust the spine if we don't want to really get in there and really manipulate the joints. But most importantly, I love it for working tight muscles or trigger points, because when you use an activator, it's a quick response, a quick release into the muscle, creates a fast stretch, and that fast stretch is actually going to inhibit some muscle tightness and muscle tone, making the athlete feel a lot looser. It's a really great tool. And one of the things I want to talk about actually before I really get into the bag is what is that we're doing. We talked about those three things: performance, reduce risk of injury, and working with lingering injuries. But what I want to talk about is, I had a great conversation with a college track coach during cross country this year. And she was concerned, not necessarily with the care that I was providing, but she felt as if the athletic trainers at the school were treating the athletes a little bit too aggressively, especially the week of a competition. They were using aggressive techniques like the scraping tools and cupping and really bruising the athletes. And her concern was that, they're breaking down tissues, scar tissues and adhesions, which is great, but the body kind of goes into a reactive healing mode, which might take away from their performance come the weekend. And I think she's absolutely correct. And I'm not doing anything like that, especially the day of competition or even a few days leading up to the competition. Everything that I'm going to do from a state of performance is going to enhance the body's performance, especially stimulating the nervous system in a way, the proprioceptive nervous system, which controls body positional sense, body awareness in space around it, as well as proprioception, where posture and things like that make the body react a lot quicker, things like that. So when I show you the tools I'm going to use, they're similar to what the athletic trainers may be doing during the week, but I'm going to use them in a much different way. I use them in a much quicker, not as deep way to stimulate the nerves underneath the tissues. So I just wanted to clarify that, because I thought it was a great conversation, and I think it was a great point to build up, and I think it was really, really cool that she was thinking that way. So anyway, so pulling out what I have in this front bag, different types of kinesio tape. So this is kinesio tape. I just like this container. Actually, I think it's rock tape in a kinesio tape container, and then rock tape here. I have different widths, some wide, some thinner, and then different adhesion, some a little bit more stickier than others, depending on how much we want it to perform. So kinesio tape is awesome. Again, it supports the muscles without restricting joint motion. Also, again, I'm a chiropractor. We want to stimulate the nervous system. So when you put kinesio tape on the skin, what it's doing is actually kind of pulling on the skin, activating the neurology under the skin to reduce pain. It's also going to bring in some circulation and lymph, and works really, really great for that. Plus giving some support to the muscles. And we could do a whole nother show on this. I love giving some tips on if it's acute injury, going from insertion to origin, or origin to insertion if it's more chronic. There's different ways to do it to stimulate the nerves and the muscles. So that's the kinesio tape. Then I have a couple of different pain relieving ointments and gels. Arthrosoothe is my absolute favorite. Tramiel is a close second. So I always have both of these in there. Talking about different gels, Magna Gel is, again, another one of my favorites. So those other two, maybe a little bit more for pain reduction. The Magna Gel is awesome because if you have something like a tight muscle or a cramping muscle, you rub some of this on. There's a really pure gel. It's mostly just magnesium. I mean, it's magnesium chloride, and that's really about it. It absorbs right through the skin into the bloodstream, and reduces the tightness in the muscle right in that spot without having to take a pill and going through your whole body. So cool stuff. Another thing that's in here is one of my favorites, and this is a cold laser. And this is a real laser. This is a class 3B laser. This is going to penetrate about 1.5 inches deep into the tissues. Why do I have a laser? Well, it's awesome at reducing inflammation and pain. And if it's a newer injury, we hit it with the laser right away to promote some healing. Lasers are a great way to heal injured tissues. I use this a lot, especially with the motocross riders, because we're seeing lots of injuries throughout the day. Track and field too. You'll see me using this at track and field meets. So this is awesome. So it's a portable one. I have a bigger one in the office. Use this all the time. Let's see what else I have in here. I've got my scissors for my tape. Then I have some things to use to do neurological assessments. This I use, if I suspect a fracture. You put it right on there. It vibrates the fracture, and it's just an old school way of sideline checking for fractures. Now, when I'm in a motocross event, they actually have a mobile ER unit there. So if I suspect anything more serious, I'm not there to treat those types of things. I'll just send them over to the mobile medical unit and have them checked out. They have everything in there, X-ray machines. It's really quite incredible what they have and what they could check out. The riders usually don't want to go over there because a lot of times it means the day is over, which they want to avoid at all costs. I'm there to help them try to get through the day, but obviously we don't want to miss a big injury. Reflex hammers, stuff like that. Let's see, I think I've got a pen light in here somewhere. I've got my rock rub for some lubrication, especially with scraping tools. I always carry a thermometer, okay? And I'm not carrying a thermometer because I'm worried about COVID or people being sick. I'm worried about people overheating. There was a pro motocross national a few years back, I think maybe a little bit longer than that. It was one of these 90-degree days, 90-degree plus days, like 100% humidity. It was really, really hot. And unfortunately, one of the pro riders came back to the pit area, got off his bike, and passed away from a heat stroke. So ever since then, I make sure I carry a thermometer on me. Also, working down at when I was down at the New Balance Nationals High School Track and Field down in North Carolina, man, those meets got really, really hot. So you always want something to be able to check temperature in a couple of different parts of the body, make sure you can cool down the athlete as soon as possible. Again, that becomes more of a medical emergency. I'm not there for the medical emergencies unless there's somebody who's not there that could take over for that. So this is a very important piece of equipment. Let's see. And cortisone cream. We need that. And let's see. One of my favorite things are breathe light strips. Okay, these are great to open up the sinuses, and obviously some alcohol wipes to kind of use these a lot on the motocross guys. I wish the track and field runners would use them a little bit more. Just a little quick wipe with alcohol wipe and put these on. There's some other good products on the market, but these work really well to open up the sinuses. So I think that's pretty much mostly this. Oh, a pen light. Okay. This is really important if, again, for a neurological assessment, if I think that somebody is suffering from a concussion, I could do some quick neurological exams with this. Okay. Oh, also, as you can see on the side here, a therapy device. This actually happens to be one that we were promoting in the office. I came up with my own line of therapy devices. This is my favorite one of the three that we did. But again, I'm using this the day of competition, not to really beat up the muscles, but again, it's more of a stimulus because the fast thump of this, that fast vibration is going to stimulate the neurology under the muscles to inhibit some pain patterns and also stimulate the muscles, get them firing, get them ready to go. We don't want to really be working deep on the trigger points with this the day of a competition, but these work awesome. Also, I've got some face paper for my table to keep everything nice and clean. Okay, attacking another pocket. Okay, I always carry a gown with me, at least one. I usually have some blankets. And the reason I have a gown, I'm not having people put gowns on, but sometimes when you're at sporting events, the athletes can be a little scantily clothed. You know, it's in between an event. They may be just cooling down. Motocross events, they get really hot. Sometimes those guys, they strip down right to their underwear. So it's always good to have something to just kind of cover them, okay? Especially with motocross. I've been at events at 60,000 people at MetLife Stadium. There's lots of fans walking by. They get really interested seeing the rides get worked on. So this is just kind of a nice thing to be able to cover them. The track and field too. They a lot of times are just in their tights or like a sports bra or something like that. It's important to make them feel comfortable and be able to cover them with this. These are two of my favorite things. These are what's called rock floors from Rock Tape. These are awesome and two different widths. What do I use these for? Well, I use this one mostly for my motocross riders because they get what's called arm pump. So you want to wrap up the arm. I put it above their head and make it tight, and you pump the blood out of the arm. And when you take it off, it gets new blood in there. It's kind of like the air compression boots that you see athletes use on their legs, but it's a quick way to do it. So this I use a lot on my motocross athletes. This one is a little bit wider. This is great for my track and field athletes. A lot of times you'll see me doing this right before they run. I just want to get some fresh blood into their legs. Again, it activates some of the neurology in the legs. This stuff is awesome. I love it. And then it brings me to my rock pods. As you can see, I have a lot of rock tape pieces of equipment in my bag between the tape, the rock floss, and these are my rock pods. We have some different sizing. This is used for cupping. Right. Again, day of competition. I don't want to be drawing so much blood in there that I'm bruising the tissues and damaging the tissues. I don't want to do that the day of a competition. So these are silicone. So there's not as much suction. I mean, you can get good suction in these, but it's not like the ones with the pump or that you're heating up. And again, I'll put this on muscle to activate the muscle, go through some ranges of motion, some stretching. Actually, I love to put this on the body and then hit it with a Theragun. It's just such great muscular activation. These work really, really great. So I got some bigger ones, and then there's some smaller ones for smaller body parts. So these are really, really cool. I really love them, and I use them quite a bit. Great on IT bands and traps and stuff like that. Forearms for the motocross guys. And deep in here, always want to carry a first aid kit right here. Okay, so again, more for like abrasions, bumps, bruises, that type of stuff. Somebody gets stung by a bee. We have some the stuff in here. Again, if I'm in a pretty big event, especially the motocross, the pro motocross stuff, they have a medical unit right there, so we'll send them to there. But anyway, I want to make sure that I've got what I need. Then digging deeper. Again, I talked about the instrument-assisted soft tissue mobilization, the scraping techniques. So I have 3 different sizes in here. I also have like the long bar, but that thing becomes kind of a pain in the butt to carry around, so I usually don't have it. Again, here's rock tape. I have the really good ones. I mean, this is good. It's plastic. It grabs a little bit differently. But I have their metal ones, the stainless steel ones in the office. I got 2 sets of those in the office. I don't want to take those to an event because if I lose them, they're quite expensive to replace. So I have these inexpensive ones. Again, they get the job done. You can get these on Amazon for like $20 or something like that. They're not nearly as good as the rock tape blades, but again, similar shapes. They get the job done. If I lose them, it's not a big deal. Again, I'm not trying to create bruising. I think even in the office, the idea behind scraping is not to damage the tissue, not to cause bruising. It used to be, when they started really doing this, it was like scrape them until you bruise them. I don't believe in that. I never believed in that. So even in the office, I use these a lot more superficially. It's a lot more kind of quick stimulus, really dragging them on the fascia and the muscle. Again, stimulating the neurology behind this, underneath the skin, to stimulate some pain relief, but also to activate and wake up those muscles before they go out and do what they're going to do. So a few different shapes and sizes of these, which are really, really awesome. And I think that's pretty much everything in that bag. Okay, so moving right along. So I got one more big pocket. Oh, I also have a rescue mask, a CPR mask. Again, I hope I never have to run into a situation where I need to use it, but we have it if we do. Again, if medical emergencies, hopefully there's an ambulance crew there that'll take over. But, the sooner you can start working on somebody, the better. So I always have this with me. Okay, then I have my stethoscope, a cuff, just in case I need to take somebody's blood pressure, listen to some lungs or heart. Luckily, I don't really have to use that too much. But again, I like to have it with me. Prescription pad, in case I need to write some notes or give somebody a prescription to get something. Some sanitation stuff. I use this to wipe down the tables and my equipment in between patients. I love these. On a really hot day, I just wet these down, and if the athlete needs it, just kind of cool them off quickly. And nice back. I think that's everything. So actually, wait. No, I have more. What pocket did I put this in? Got so many pockets, I lose track. There. Okay, so I usually carry at least two different stim units. This is just a TENS unit. Again, reduce pain, reduce some muscle tightness. This is a microcurrent. Again, I use this a little bit more for pain relief, but I love microcurrent machines. This one gets used a lot, as you could tell, to promote some early healing and an early injury. If somebody is injured, I use this a lot in the office. It stimulates healing within muscle damage and things like that. So these tools are awesome. I got a bunch of extra pads and electrodes. I do have this kit. This is really important. This is a dehydration kit. So if somebody is really dehydrated, I'd love to have stuff like this on me to rehydrate them quickly. One of the things I usually carry, and I didn't have my bags, I ran low on those, is I usually do have hydration sticks or like energy gels if somebody wants a quick hit of some energy. But most of the time, the athletes I'm working with are on top of that stuff. But I always like to have extras. I do like the hydration stick, especially on a hot day. This is more if somebody's really suffering from dehydration. Actually, New Balance Nationals one year down in North Carolina, it was a spectator, it was a woman, and I could see she was in the shade, but she was like going down, and she was just really, really highly dehydrated. So I was able to just get a quick little salt packet, put a little bit under her tongue, under her lip, and she bounced right back from it. Then I sent her over to the medical unit just to get checked out, make sure there wasn't anything else going on. But that was, I was glad that I was able to do that. I just had somebody run over to the snack bar and get a packet of salt, just kind of got her sodium chloride back up, and she was good. Also for like heart attacks, things like that, you may want to have some aspirin, but that's usually my first aid kit. So that is, I think, my whole bag. You see, I got my name on there. So anyway, why do you think an athlete would want to get chiropractic care on the day of a competition? There's lots of benefits. We already talked about the performance, and the performance is the big one. Obviously, chiropractic is great reducing pain. We don't have to argue that. It's really great. But for an athlete, again, we talked about increasing proprioception, positional sense, posture, things like that. Adjusting the rib heads is going to get the lungs to open up a lot more freely, better exchange of oxygen. Regular chiropractic care improves heart function and heart rate variability, so their body responds a lot quicker as far as how quickly the heart rate reacts. It's really great for that. It's a sign of autonomic function, so that works really well. Improved range of motion, so you can turn your head a lot easier. Reduce muscle tightness. So all of those are things. The muscles are less tight, you're going to be using less energy, and you just feel a lot looser when you're performing. Also, improved cognition, brain function. When you adjust the spine, it's all about stimulating neurological function, just lights up that frontal cortex, and then it's going to have a motor response back into the muscles, and it just really works great. I highly recommend it for athletes, and I've worked with some really high level athletes. It's been an awesome experience. Again, I look to continue with the pro motocross and hopefully do more with USA Track and Field, and focus on my own girls and their teams. And when I work those events, anybody's welcome to, if they have an issue, want to talk with me or get worked on. Obviously, if they're under 18, I need parental, permission. That's usually not a problem to get. But yeah, I love what I do. I'm blessed to do what I do. This went on a little bit longer than I was expecting, so hopefully you hung in there. If you have any questions, don't hesitate to ask. If you know any athletes, or if you're an athlete yourself looking to improve their performance, chiropractic is a great way to do it. So if you're in the area, think of us. So that's all I have to talk about tonight. And next week I'll have another topic. I'm not sure what it will be, but maybe it won't be 20 minutes long. Anyway, hope everybody has a great night, and we'll see you next week. Thank you.